Health equity for all. Is it possible? Even before the COVID-19 pandemic, health disparities among Black and Brown communities were alarming. According to the CDC, Black and Brown communities are up to 2 times more likely to have major long-term health conditions than their white counterparts. They are significantly more likely to go to the emergency room for health concerns. Black populations at 40%, Latino populations at 30%, when compared to 20% of white patients. Similarly, there is a nearly 4-year gap in life expectancy between Black people and white people. Although Black Americans only make up 12% of the US population, they have accounted for nearly 30% of deaths related to COVID. When you take a comprehensive look at these statistics, you can simplify the problem to 3 main areas: access, outcomes, and costs. Underserved populations struggle to access the care they need, especially in rural areas. When they can get care, it's not making a huge difference in their health outcomes. And regardless of their outcomes, medical care is often too expensive. We've been having conversations about health equity for a long time, and researchers have been collecting and analyzing data to show us these trends. We know what the problems are, but how do we solve them? I've been a health entrepreneur and consultant for over a decade, and my company SynsorMed has been working closely with physicians on the ground doing the work in serving underserved populations. Here's what we're seeing. First, let's tackle access. Getting to the doctor's office in person isn't always easy for people who don't have transportation, especially when they live in rural areas far away from a city center. The solution? Remote healthcare. Remote healthcare has helped increase access to care for patients by connecting them to their doctors by phone, video call, or even text. We saw the use of telehealth increase significantly, 63-fold among Medicare patients at the height of the COVID-19 pandemic. Next, let's cover health outcomes. Underserved communities, Black Americans in particular, suffer from chronic issues like high blood pressure and diabetes at higher rates than other groups. For context, about 55% of Black adults have high blood pressure. So how do we address this? Many factors contribute to a patient's health outcomes, from behavior to living conditions to genetics. But changing behavior alone can go a long way in managing chronic conditions. According to Harvey Health, part of the treatment for most chronic conditions involves lifestyle changes. You know the ones we mean: stopping smoking, losing weight, exercising more, eating better, and so on. In our interactions with patients, we've seen that the best way to make and maintain those healthy lifestyle changes includes, first, making a plan with the patient and setting simple goals. Second, educating patients on best practices for staying healthy, for example, eating less sugar, watching caloric intake, and such. 3, measuring their results using remote monitoring, because you can't change what you aren't measuring. And finally, celebrating their success when they reach milestones. Now let's discuss costs. The cost of healthcare can put patients from underserved communities in a difficult position of choosing between their healthcare and their living needs, like housing and food. Healthcare debt is a real thing for millions of Americans, and is more pronounced in Black and Brown families. So how can we help people make healthcare a priority without breaking the bank to get the help they need? Most healthcare debt comes from major procedures. The best way to decrease costs is to reduce the need for these major procedures in the first place. How can we do that? From the healthcare provider's side, there can be a better job of communicating and connecting with patients. When speaking with underserved populations, linking healthcare to things that patients care about, like family and spending time with friends, makes their health concerns real. Connecting to patients this way requires empathy. Unfortunately, research shows us that not all patients receive the same level of empathy from medical professionals. We have also found that having healthcare professionals who can speak the patient's language helps get them to open up and understand the significance of the changes we recommend. Ultimately, we believe that if we focus on increasing access, improving outcomes, and lowering the cost of care, we can see these disparities start to improve. If you'd like to learn more about the business of healthcare, please subscribe to my channel.